overactivity in the brain that leads to delusions, which are false beliefs. I think the CIA has embedded a computer chip in my brain, and nobody can talk me out of it because I know it's true. Hallucinations, which are false perceptions. I'm hearing voices, people are talking to me, but there's nobody in the room, or there's nobody in the room who's saying anything. And this is the main forms of so-called positive symptoms. You can also see disorganization of thinking, which means that people, by the way they speak, are having kind of disconnected and disorganized and sometimes incoherent thoughts. The second category of symptoms are what are called negative symptoms. And these are believed to reflect a deficiency or an underactivity of areas of the brain that control emotional regulation. And these symptoms include lacking interest in things, lacking the ability to experience pleasure, the kind of what's called flatness of affect, meaning I talk, but I'm talking in this monotone and I don't seem to get excited, even if there's a tremendous parade or, U2 is playing a rock concert or we're going to go to a movie or we're at a birthday party. There's no emotion shown. And then the third category of symptoms are what are called cognitive symptoms. And this is impairment of the normal cognitive functions that we all use every day to perform our daily jobs and responsibilities. So the ability to remember things, to focus, to pay attention, to concentrate, to remember something, to make mental evaluations about problems. In other words, I've got to meet so-and-so for lunch, but I've got to finish my job first, or I've got to get up at such and such a time to be at the doctor's office. So I don't plan things well. I don't sort of figure out a way to solve a situation. These are the main forms of symptoms that characterize schizophrenia.